Your time now, 6:34. All this week, we're helping you get back into the swing of things for back to school. And this morning, we're taking a look at how schools are now preparing to deal with the opiate overdose epidemic here in Rhode Island.
According to the Department of Health, the number of people under the age of 18 treated with the overdose antidote Narcan is on the rise.
And that's why when students return to class in the fall, all public middle and high schools will be required to carry kits to treat these kinds of overdoses. This morning, we're looking at the new measure as part of our in-depth back-to-school coverage.
It is an issue we have been tracking for years now.
All I remember is blacking out.
A nurse found me blue and unresponsive.
I stopped breathing.
Rhode Islanders from all walks of life brought back from the brink of death after an overdose. According to the nonprofit Trust for America's Health and data from the Centers for Disease Control and Prevention, Rhode Island has the 7th highest rate of drug overdoses in the country. And now the focus is on children as young as 11 and 12 years old.
It's a problem that is all of our problem. You know, nobody's immune from it.
Representative David Bennett is chief sponsor of new legislation that requires public schools with students grades 6 through 12 to be equipped with these overdose antidote kits.
My goal is that it's never used. It expires, you know, but we're ready. And that's the biggest thing with drug use, is to be ready to keep that person alive until the EMTs can get there and take them to the hospital.
According to the Rhode Island Department of Health, between July of 2014 and July of 2015, 2 13-year-olds, 1 14-year-old, 4 15-year-olds, 6 16-year-olds, and 7 17-year-olds were treated with the overdose antidote Narcan. That's 20 in total, up from 15 the year before. When the Department of Health asked school nurse teachers late last year about opiate overdoses, 15 of the 78 nurses surveyed said that they had called 911 several times over the past 3 years because of a suspected student overdose. Representative Bennett says he hopes all school staffers will take the opportunity to be trained in recognizing an overdose and using Narcan kits. He says it will cost the state $7,000 total to equip every public and public charter school with antidote.
If it's never used, that's a good thing, you know, but use it once. What price is a young person's life worth?
And the Department of Health tells me that it is developing these kits and their training for school nurses and other school staffers. New York State also equips their schools with Narcan. In Connecticut and Massachusetts, it's currently up to individual school nurses to receive the training and buy the antidote if they want it in their schools.